All right, let's talk about something that's probably in your medicine cabinet right now. You know, that little bottle you grab when a headache hits or your back is just killing you after a long day. We all do it, but have you ever really stopped to think about what's in those pills?
I mean, when you're in pain, you're just looking for relief, right? But this is a really important question, and today we're going to dig into what the science actually says about it. So, first things first, let's be super clear about which drugs we're actually talking about in this explainer.
Yep, these are the big ones, the household names you can grab pretty much anywhere. They're so common, so everyday, that we barely even think about them.
The official name for this whole class of drugs is NSAID. It's a bit of a mouthful. It stands for nonsteroidal anti-inflammatory drug. And look, these things are workhorses. They do everything from knocking out a fever to calming down inflammation. And that's exactly why they're just everywhere.
So, because literally millions of us are using these things all the time, scientists really wanted to nail down an answer to that big question about heart safety. And that brings us to the heart of what we're looking at today. Now, the information we're talking about comes from a really big deal review in the Clinical Journal of Pain. And get this, it wasn't just one study. These researchers did what's called a systematic review. They pulled together and picked apart a whole decade of the best research out there on this topic. So, this was the mission. After sifting through all that data, all those trials and analyses, what did they find? What's the real story when it comes to NSAIDs in our hearts? Let's get into it. The review dug into a few different potential risks for the cardiovascular system. We're going to start with one of the worries you hear about most often. Okay, so one of the big concerns was about hemodynamic effects, which is just a fancy way of saying the impact on your blood pressure and blood flow. And here's what they found. For short-term use, taking it for a few days for a specific problem, those concerns might actually be a little overstated. That's a really important detail. How long you take it for seems to make a big difference. But that's not where the story ends. The review uncovered something else, and this is the one finding that you really, really need to hear. And there it is, straight from the source. Myocardial infarction, that's the medical term for a heart attack, was found to be a very serious but rare side effect. Let's unpack what those words actually mean together. This is the whole thing, right here, this balance. The risk is absolutely real, and it's serious. We have to respect that. But, and this is a huge but, the data also shows it's a rare event. This isn't something that's happening to most people, or even many people who pop an Advil. Getting that distinction is just crucial. So, once you get your head around that balance between serious and rare, what do you do with that information? Well, it really all boils down to a personal balancing act. Exactly. The point of all this research isn't to make you throw out all your painkillers. Not at all. It's to give you the power to make a smarter choice, to actually weigh the benefit, getting rid of your pain, against that small but serious potential risk. Okay, so let's just quickly recap the main points. 1. The heart attack risk is real, but thankfully it is rare. 2. Popping a pill for a couple of days seems to be less risky for some of these side effects. 3. And this one is so important, your personal health matters. Your own heart health is the biggest piece of the puzzle. And finally, the study gives a clear message to doctors. You have to think about this risk really carefully, especially if your patient already has a heart condition. And really, that's what it all comes down to. With everything we've just talked about, maybe it's worth having a new conversation with your doctor. Not about something new and scary, but about something old and familiar. It's a pretty simple question to ask, and it could make a world of difference.